Okay, so this lady here is has been a client of mine for a while. Um, I did her lips probably 6 years ago, and even though I could see a lot of color there, she feels that they are dull or faded, and she wanted to refresh them, especially around the Vermilion Border where she did lose quite a bit of color. So she does have big, beautiful lips, and they do have silicone in them. So the silicone itself is pretty firm, and that makes working on these lips really easy. I really don't have to stretch too tight or too hard. So you'll see at different points in the video that I'm really not stretching much at all, and that's because the silicone provides such a firm base to work off of that I really don't need to stretch that much. So it's rare that you find, it's rare that you get someone who has silicone because people really just don't do that anymore. And so I don't have a lot of lip clients that have that, but I have seen it before in the past. So we're doing her lips today with Permablend Sweet Melissa. And I'm just using that color straight because she already has a base. I don't have to neutralize anything. The machine is the Flux-S by FK Irons, and I purchased that at microbrew.com. I have it wrapped with grip tape, and it's just in a plastic baggie. So right now, my goal is just to set my template. I don't really care if the outline is perfect. I just want to be able to set the template so that when I wipe away, it's still there. So with each pass, I want to try to get in as much color as possible because I don't want to waste the pass. And I want to get in and out with as few passes as possible. However, when I'm setting the template, I'm not really obsessing over how much color and saturation is there because I just want to make sure that the template's set. Because once I wipe, and right now I'm wiping with a cotton round with witch hazel, and I'm applying a secondary numb. This is ultra duration. For my primary numbing, I use Zensa. We carry that at TeachMePMU.com. And the outline that I've used is a blue gel pen that we also sell at TeachMePMU.com. They are disposable gel pen refills, so that's super important because if I need to, for whatever reason, pull the pen out and redraw something, I can do that and I don't have to worry about cross-contamination because I'm using a disposable. So again, I'm just trying to set my template. I don't want my design to go away because once that secondary numbing gets in there, the lips are going to blanch, they're going to turn white, and I'm going to lose the definition of that vermilion border. So I want to make sure that I've got, at the very least, a bloodline. So bloodline is when you have just a red line from the inflammation of the needle and there's no color there. So even if I just pass the needle across the skin, I'm going to get a bloodline, and that's going to give me something that at least I can follow. I'm also using Viva paper towels. I love Viva because they are soft. If you've ever been tattooed with like a Bounty or something like that, you know that it's like being wiped with sandpaper. So I do like to use the Viva. They're nice and soft. I just rip them into little pieces and put them on my tray. And you can see I'm using the Viva, the paper towel underneath my finger so that I get a better grip on her lip. Again, here I'm wiping with a cotton round with some witch hazel. And there's a green ointment on that stick right there that you can see. That is Ink Ease from, I get that at Ultimate Tattoo Supply. It's a CBD formula, and I do feel like the CBD does help, but it's good to use an ointment whenever you're doing any type of tattooing. Probably, and here, I'm not paying attention, and I dipped my micro brush into my pigment instead of into the numbing. So I wiped it off. but I feel that it's important. I mean, except for the eyeliner, anywhere else when you're tattooing, you want to use a little bit of ointment because it keeps the skin moist and supple. Um, and so that the pigment doesn't stick so much on the skin, you can wipe it nice and easy, and it makes it a little more comfortable for the client. So now here I needed a little more traction under my thumb, so I put the paper towel under my thumb. And you're going to notice that I do this a lot because I am using the ointment on her lips, and so they can be a little slippery. So I want to make sure that I've got a good grip. So I'm using a 7RL. This is a big Wasp cartridge. I get these on Amazon. I've been using Big Wasp since their first generation needles. They're on their fourth generation, and they just keep getting better and better. They're a very affordable cartridge. The quality is great. I happen to really like these. I also use quartz, the Peak quartz needles that are made for PMU. I get those at Ultimate Tattoo Supply, and I use a Vertex from Microbu. So I'm using the 7RL, and I first just set my template, and now I am going back and through some etching and some circular motions, I'm thickening up that outline. And now I'm going in and trying to make it more perfect and get nice saturation there. You can't see the power, the little power supply on the machine is facing the opposite way, so you can't see, but I'm using it on the blinking blue setting, which I think is 6.5. I try to use as low of a power setting as I can because I find that a higher power setting will cause more inflammation, more bleeding, and consequently more swelling. So, but you have to remember that the bigger the needle grouping, the more power you're going to need to get that to puncture through the skin. So for a 7RL, this is a really low speed, but again, she has the silicone filler, and which is providing a really nice base for me. And so I've got a nice firm canvas to be working on. And so the needles are going in very well. You want to ease up a little bit as you get into the corner because the skin there is thinner. And you want to, avoid the risk of going too deep. Again, wiping with the witch hazel on a cotton round. Even though I'm using a very tiny bit of numbing, I do like to apply it several times because I want to see those lips blanch so that I can really see what I'm doing. And of course, to keep her comfortable. Using a secondary numbing with epinephrine. Also, epinephrine is a vasoconstrictor, which means it's squeezing the veins in the area closed, and that's keeping blood from, filling up that area. And that's why the lips turn red, or the skin, or anything that you're working on. Or turn white rather. It's because the blood supply from that area is being restricted. And so whenever we can do something that prevents bleeding and swelling, I think that that's always a good thing. And, using the bigger needle configurations for me is essential as well. A lot of people do lips with a single needle. And while it is beautiful and the work is beautiful and they're able to do it, I am not a very good single needle user. If I'm not doing hair strokes for all my other procedures, I do not do single needle. I find that it takes me way too long, and I find that I get a lot more swelling that way. I personally like to go in and out as quickly as possible. And coming from being a tattoo artist into the permanent makeup world, I am just used to using bigger needle configurations. Single needle is really not something that I ever used as a tattoo artist. So, it's just not part of my wheelhouse. It doesn't mean that it can't be done. And there really is no right or wrong way. you know, if you get the results that you're looking for, then you've done it correctly. So you can see with my left pinky finger, I'm using that to not just anchor my hand on her face, but I'm also pulling towards me and a little bit down to the left with it. The fingers of my right hand, I'm using my thumb to pull towards myself and my index finger to pull away from myself or push away from myself. And that's giving me as much of a 3-point stretch as I can get. And you see there, I went to stretch and I felt like I didn't have enough grip, so I put the paper towel underneath my finger, and that gives me more traction. So now I'm still using the 7RL, and I've beefed up the outline, and now I'm just using some like hatching motions to blend that line down a little bit. So like I mentioned, she did have her lips tattooed before by me. And the outer edge, the Vermilion Border, has lost a lot of color. It's lost a lot of its definition. So I do want this outer edge to be slightly darker. And darker is a bad terminology to use. I want it to be more saturated. So I want the color to be richer there. And so I'm making sure that I get nice, solid color by me doing some etching and some hatching, but I'm also like right now using some small circles. And there's really not a lot of rhyme or reason to how I'm doing it. It's just what I'm comfortable with at the moment. Sometimes I'll do like cross hatching, sometimes I'll do circles. It just really depends on like my mood and my level of focus, I guess, at the time. So if I do the same motion the entire time, I think I kind of like lose myself in the monotony. So I like to switch it up. And again, you know, there's always a wrong way, but as far as techniques go, there's really no right or wrong technique as long as it's working. So if you just love doing circles and you don't like doing any kind of cross hatching, then go with that. So this stretch here, I'm pulling away from me with my pinky finger, which is also my anchor. And then I was using the index finger of my right hand to just press the lip so that I can get into the border there. So my middle finger of my right hand is pulling up. My pointer finger, my index finger, is pulling down and pushing. And then I'm able to work in between those two fingers. You also want to keep in mind to work in small spots, right? So if we work in too large of an area, we can't possibly stretch all of that properly, and we can't possibly keep the proper angle because the lips are, they're three-dimensional. There's a topography about them, and you want to maintain as much of a 90-degree angle as you can, 90 to 45 degrees, not more than that. And so I work in very small spaces, just a little at a time. Now I'm switching to a 11 curve magnum. This is also Big Wasp. And because it's so big of a needle grouping, I've raised my power up to the green setting, which I think is like 7. And I'm putting a little bit of that ointment on her lips to keep her moisturized and comfortable. So again, the reason that I raise my power setting up a little bit with the higher needle grouping is because you have to remember that the power coming from the machine is being divided by all of the needles, right? So if you've got a 7 power on your power supply, right? If you have a single needle, all 7 volts of that power is going to that one needle. Right now I have 11 needles, so that means it's being divided. And I'm very bad at math, so I'm not going to try to do the math there for you, but you understand what I'm saying. The power of the 7 volts is divided through 11 different needles, which makes the punch that it has weaker. And so we have to make sure that our stretch is good, and that we've got enough power to penetrate the skin. So here I'm using the pinky of my left hand to anchor my hand and pull down towards the chin. And then I'm doing the same thing that I did on the upper lip, but I'm doing it on the bottom lip now. So I'm using my index finger and my thumb to stretch that bottom lip. So now I've switched to using a wet wipe. I don't really know why I use one over the other. Sometimes it's just I guess whatever I'm feeling at the time. Sometimes I'll wipe with one and I feel that it's not enough, like I'm not cleaning it enough. And so I'll switch to the other one that might work better on that person's skin. So now the beauty of a Magnum is that it's like using a really large brush, and you can make big sweeping movements and get a lot of color in all at once. The downside is that you have less control. You have to really be comfortable using a Magnum, especially if you're going right up against that very thin line that we created before. And so sometimes you'll see me turn the needle sideways, move sideways. Sometimes I'll lean back, like kind of on the heel, and use very few needles just to get into a nice tiny little spot or an edge. And right now I've got it kind of at a 45-degree angle to the outline, and I'm just sort of pushing forward with it. So there you can see me pushing forward. And then I might turn it the other way and go up and down a little bit. So one of the things I've always preached about is not running your machine in the cap because of the risk of hitting the needles against the cap, which can then either dull them or hook them or burr them. And so I've always taught and preached that you need to shut your machine off. Now with the, it was much easier when we were using machines that had a foot pedal because you controlled everything with your foot. It gets a little more difficult now with the push button supplies. So if you find that you keep hitting the cap, then obviously every time you hit the cap, you need to change your needle because your needles are now compromised. And if they are hooked or burred, they're really going to destroy the skin. And it's going to prevent how much color you get in. It's going to prevent how much color retention you have. And it can also potentially scar the area. And so if you're finding that you do that often or even just once per procedure, then you should not be running your machine in your ink cap. If you feel comfortable that you can do that without hitting the needles, then go for it. The tips for doing that are to use a larger cap. I know that none of us like to waste pigment, especially when it's very expensive, but if it's too low to the bottom of the cap, you are going to hit it with the needle if the needle is running. So, use a bigger cap, have more pigment than you need. And if you see that you are running down to the bottom, then you need to refill. That way you could prevent hitting the needles. And so I do have a little bit of trouble in some areas getting the color in. And she did mention that she had recently had laser and it removed some like dark spots that she had on her lip. I don't recall, last time I tattooed her lips was so long ago. I don't recall her having dark spots at the time. So it's possible maybe she had some hyperpigmentation from like chewing at them, which she mentioned that she sometimes does. like as a nervous habit, sometimes we like chew on the lip, or possibly just like a little hematoma or something from banging her lip or something. And so I do find that skin that has been lasered is sometimes more difficult. I've just not encountered it in the lips. And as always, as we get into that inner corner, we're going to lighten up on our hand pressure because we don't want, you don't want to go too deep in those corners. And not only is the skin of the lips, more shallow in those areas, thinner in those areas, but filler of any kind, regardless of whether it's hyaluronic filler or silicone like this, you usually don't put filler in the corners, right? So we don't have the same depth or the same cushion that we do in the rest of the lip. Give her a little more numbing there. And then move on. So I think it's really important to give any skin, but particularly the lips, you want to give it a little bit of time to rest and to relax. And what's going to happen is the color is going to kind of come to the top. So sometimes you can be working and you feel like it's just not dark enough. You don't have enough. Maybe there's like a lot of redness, a lot of irritation. And if you simply let it rest for a few minutes, when you come back to it, some people call it, that the color is oxidizing at that point. But, if you give it a moment to rest, the color is going to bloom. It's going to develop and you're going to see more of it. And that's really going to prevent you from overworking the area. So here, the filler in her lips is providing me enough foundation that I'm able just kind of to pull towards myself, and I've got enough, it's firm enough for me to tattoo on it successfully. I don't really have to stretch too hard. So if you watch what I just did there, my index finger under with the paper towel underneath it pulled down, and then with my middle finger, when I put it down, and then I spread it away from the other finger, and so that's giving me that two-way stretch there. And then my pinky finger is going over into the corner of the lip, and I'm trying to pull down there. Here, I'm not using any stretch from my left hand, and I really don't need it. And now I'm back to using the pinky, not even stretching as much as just resting my hand there. So right now, I'm using like up and down motions, back and forth motions, and then some oval pushing, just to make sure that the area is nice and saturated. So if you noticed, when I went to put my hand down this first time, I started with one stretch and then I switched to another. I don't, just like there's no perfect technique or right or wrong technique. There's really no way, right or wrong way to stretch. As long as you're getting a good stretch, it doesn't really matter how you do it. So you just do what's comfortable for you. And, I have a lot of people that watch my videos who are left-handed and they enjoy watching another left-handed person work because for some reason you would think that being left-handed is exactly like being right-handed, except, the opposite side. But for some reason, it's just not. Left-handed people typically just do things weird. And so how I anchor my hand and how I stretch may be different than how you learned how to do it or how you're comfortable doing it, and that's fine. As long as you're able to get as close to a 3-point stretch as you can, and that the skin is nice and taut, and the color is going in easily, then you're doing it right. If the color is not going easily, or you find the skin is buckling or puckering, then you need a better stretch. And as you'll see, I think this video is under 40 minutes. So even with larger size lips, because I'm using a larger needle configuration, that 11 Magnum, I'm able to bust through this lip in under an hour. And I feel like that's super important because numbing only lasts for so long. And if we use too much of that secondary numbing, we're risking worse pigment retention. The more numbing you use, the more it takes up in the space, or I can't even speak today. The more numbing you use, the more space it takes up in the skin. And so you want to use as little as possible while still keeping your person nice and comfortable. But also with the epinephrine in the lips, you do run the risk of bruising. And so we want to use as little as possible, but still keep her nice and comfortable. So if I could do this in under an hour, then awesome. If it's going into, I've seen people say 2, 3, even as much as 4 hours, especially when they're using, like single needle configurations. Not only is that, just a lot of trauma to the skin, but I don't know about you, I cannot sit and just lay there like that for 3 or 4 hours. Like that is a really long time to just lay there, particularly if you are in pain. So, if the numbing is starting to wear off or they're getting too swollen and uncomfortable, especially with all of the cleaning and the wiping, that can get really uncomfortable. And to lay there for literally hours, is just not fun for the client. So from a marketing perspective, I feel that if we could keep our clients comfortable and we can get in and out relatively quickly with as little swelling as possible, it's going to make the entire experience better for the client. So, when people say to her, "Oh, that's really beautiful, but did it hurt?" What I want, or what I hope that she's going to say is, it wasn't that bad. I didn't really bleed. I didn't really swell. The healing went quickly and it was a little uncomfortable maybe, but overall it was pretty easy to do. And that is going to be the defining thing that has her friends booking appointments, right? Because if they're like, "Oh, that looks so good. Where did you get it done? And, how much was it?" And all this stuff. As soon as she says, "But it was really uncomfortable or really painful, and it took forever to heal, and I was swollen for a really long time, and it was just a lot of discomfort," that might be the thing that prevents them from booking the appointment. So there you saw I'm tipping the pigment pot backwards a little bit because I did not want to risk hitting the needles on the bottom of the cap, and I'm starting to run out of pigment. So soon I'm going to fill fill that back up. But for now, I'm just tipping it sideways so that whatever is in the pot flows down and I can grab it without getting too close to the bottom. And same thing here as I was doing on the other side. Some cross hatching, some back and forth, some circles or ovals. Just whatever I need to do to get the job done. And sometimes you'll see me move a little faster and sometimes a little slower. If I'm moving faster, it's because I want to kind of dust the color over it. And if I'm moving slower, it means that I want more saturation there. Cotton rounds with witch hazel. And again, even though I keep applying this numbing, I'm not using a lot. Like you can see that you don't really see a lot of liquid going on there. So I'm trying to just use as little as possible, but enough to keep her comfy. Some people have asked about my tray cover. They are spa, like the disposable spa liners that you put for pedicure. And I just buy those on Amazon. I got that tip from Mary Richardson. They're great. They're cheap. You could get a lot for very little. I don't even know how much we pay for them. We buy them in like these big boxes, but they go right over any size tray. And at the end, you just pick, turn it inside out, pick it up and throw it in the garbage, and you're not touching anything. And so that's really nice. And I also use it to cover my stool so that my stool is clean. And in case I have to touch it to move it or raise it up or down, then it's covered and it's protected as well. You can also use it to cover the head piece on your table. So here I'm pulling down or towards the chin rather with my pinky finger of my left hand. And then I'm sort of like reverse pinching with my thumb and my index finger. And just working in very tiny little spaces. I feel like I have a lot more control when I work that way. My stretch is good. My angle is good. I've got total control over the needle and total control over the client too, right? If she suddenly moves or jumps or just, I don't know if you've ever had this happen, but sometimes they'll talk to you while you're tattooing their lips. And so, you don't want to risk if you're using like these broad movements, then you may run the risk of losing some control over where that pigment's going. So working in tiny little spots, it lessens the risk of that. And you can see here, the color is developing really nicely. It's a really pretty pink. This is, I don't know if I mentioned it before, it's Sweet Melissa from Permablend, which is a color that I use a lot. It's just a really beautiful pink. It looks good on almost everyone. And it has enough warmth in it to stay like a nice, juicy, warm pink, as opposed to like maybe a pink like French Fancy, which is, in my opinion, a lot cooler. If you're wondering why I keep going back down to the outer edge of the lip, with every pass that I make, I am trying to get as much color in as possible, but I am not obsessing over perfect saturation, right? Because like we said before, we want to give it a little bit of time to rest so that the color develops or oxidizes, without overworking it. And so each time I go and make a pass, I will go over the spot that I went over before, at least overlap a little bit. And what that helps me do is to build the color, especially if I'm trying to create like an ombre effect or just like a gradient. It helps me build up that color to ensure that the outer edge is going to be the higher saturation and that the inner edge is going to be the lower saturation. And then as I get into the inside of the mouth, so there are three areas of skin, three different types of skin in the mouth. You've got the skin of the lips, which is what we're tattooing into. We have the skin of the face, which is outside of the lip. And in between the skin of the face and the skin of the lip, we have what is called the vermilion border. And typically, the vermilion border is going to be a little pronounced. There's going to be a little ridge there, and that will usually indicate to you where the lip stops and the face starts. Some people, based on their ethnicity, will have stronger ridges than others, and others will be more flat. Typically, you see that, range within different ethnicities. If they have filler in their lip, they might have more of a ridge. And then younger people versus older people, older, more mature lips are going to be flatter. And the distinction between the lip and the mouth, or sorry, the lip and the face is going to be harder to find. And so typically it's where you see the wrinkles of the lip, like the little lines of the lip, it's where you see them stop. And so we don't go far outside, or let me amend that. We typically do not go past the vermilion border. Sometimes we need to go over that border just a little bit because there is some asymmetry or scarring or something like that. And in that case, there's techniques for blending that so that it doesn't look as obvious. But for the most part, we are not going really outside of that vermilion border. Now, as we get closer to the inside of the mouth, the skin will change again, and it changes from being lip skin to being mouth skin. And mouth skin is very different, and it is always wet, and it holds the pigment differently. For the most part, pigment is not going to stay there. So it's useless to really get to the inside of the mouth like that and try to pound pigment in there because it's simply just not going to stay. So what I like to do is, in order to avoid having like a clear line of demarcation from where the color stops and the inside of the mouth begins, especially if I'm using a darker color like a deeper red, I will just gradient it into the inside of the lip. Just blend it out. And at this point, I'm almost completely finished. So I'm just looking around for little spots where I may need a little more saturation, some mist color. But for the most part, I am done. I'm just perfecting, and then I'll clean her up and she's out the door. And as you can see, she really doesn't have much swelling. We really didn't see any blood coming up to the surface. The swelling is minimal, and she's been pretty comfortable.